Mr. President, I shall try to finish my presentation in 5 to 10 minutes. I think the audience can be assured of that. I am responsible for actually implementing the management information system for the health. But e-health is a new issue in Bangladesh. And as there is no other department to take over the responsibility, so my department has been also given the responsibility to implement the e-health. So I shall try to briefly describe to you what has been done in a very short time. In Bangladesh, actually, the government, there is a new government which came in 2009 January with a new vision. This is called to implement a digital Bangladesh vision, to implement the ICT in all sectors by the year 2021. And virtually our e-health program is relatively new and beginning from 2009 January. And you know, at the initial period, there was little preparation, little readiness to implement the e-health in the country. And you know, from the government system, there is less accountability, less motivation. So these are the problems. So from the government perspective, we tried to implement the e-health to provide the basic remote health care through implementation of the ICT and so that it can cover mass population. So by this time, actually, we have introduced many services, near about 20 services, and all the services which have been described here in this conference. But today, in front of you, I shall only describe about the remote health care. But I shall also include the mobile health services here because I shall have no chance to discuss it in the next session, which will discuss the mobile health services. So there are three principles of e-health in Bangladesh. This is improving the health system efficiency through introduction of ICT, bridging the urban-rural digital divide, and reaching the citizens through the service. But we have many hard realities. There is resource constraints because the country was not ready to invest for ICT. And there are other competing health priorities because there are ongoing health projects and we cannot curtail budgets from those projects. And the most important reality is there is a acute shortage of skilled ICT staffs. And in fact, in my office, there are very little number of staffs. I am a medical doctor, and I have taken the charge of my department only 2 years back. And you can imagine that maybe the understanding of ICT, actually I have the most risk understanding of the ICT in my department. So heading a small team, within a short period of time, I shall describe to you what we have achieved. So given the situation, we have taken the principle of our IT solutions like it should be simple, it should be low cost, it should be innovative, and this should be locally appropriate. I shall describe to you about the different types of m-health services we have introduced. We have introduced video conferencing, telemedicine, and the community health database to ultimately provide health services to the people living in the remote community of the country. So this is a map of Bangladesh, and this describes the different levels and the health types of healthcare facilities. So at the national level, there are super specialty hospitals. There are 6 divisions in Bangladesh where medical colleges and the tertiary hospitals are located. There are 64 districts where there are district hospitals. Each hospital is about 50 to 250 beds. There are, under the district, there are upozelas, and you can call it sub-districts, and there are 483 sub-districts in the country. And in each sub-district, there is a hospital with 31 to 50 beds. Under the upozela, there are unions. In Bangladesh, there are 5,001 union. And in the union level, there is outpatient facility, and under that, there are wards. So each union is comprised of 3 wards. So we have got 15,003 wards, and in the ward level, there are community clinics. And virtually, we have about, currently we have got 14,000 community clinics, and we'll build another 4,000 community clinics maybe in 1 or 2 years. And one community clinic will provide service to 6,000 rural community people. And by this time, in 2 years or less than 2 years, we have connected with internet all the health facilities and the health stations, beginning from the national level up to the sub-district level. And maybe in next 1 year, we will complete connecting all the community clinics in the next 1 year. So the connectivity in all the public health facilities will be completed by 1 year. So this is the current connectivity status of the health facilities in the country. So now I shall describe the mobile health services which we have introduced. We have provided one mobile phone to each of the Upazila hospital and each district hospitals. That means 482 hospitals of Bangladesh have been provided with at least one mobile phone. This means all over Bangladesh has been covered with the mobile phone services. One doctor at any time during the 24-hour remains ready with the mobile phone, and the phone numbers are known by the people living in these catchments. So during the 24 hours, 7 days, people can call the doctors. A doctor is ready to receive the call of the people and answer the people's problem and provide the medical advice free of costs. So these are the benefits of this mobile phone health service. It has got wider coverage, reaches to everybody, anywhere, simple to use. It is a better option to avoid the unqualified doctors. And it also limits the unnecessary visits of the patients to the health centers. This means the limited number of healthcare providers can satisfy the visiting people to the health facilities. And also they can provide a little amount of logistics, because this small amount of logistics is needed to be shared with a small number of patients. And we have got SMS broadcast system. So under the health service, there are about 100,000 staffs. And we have a mobile phone number databases of all the staffs. So if there is an emergency situation, we can broadcast messages to all the health staffs, and immediately we can mobilize them or we can provide them health advice just in less than 1 minute. We can also, actually, by the participation of all the mobile operators working in Bangladesh, we disseminate on behalf of the Ministry of Health some public announcements. For example, the dates of the National Immunization Day, to advise to bring the children to the immunization camps, to participate in the Vitamin A week, or also encourage mothers to breastfeed their children. And we can also disseminate special assignments, educational things to the health staffs. We have introduced one pregnancy care advice by SMS. So any woman who is recognized as pregnant can be registered by the women themselves, by their relatives, or by their health workers. So at different times, during the whole pregnancy period, specialized advices automatically reaches to the women. And currently, we provide messages in English, but we are introducing messages in our local languages as well as in voicemails, so that they can understand it. But at this moment, we advise them to go to the neighbors who understand English and explain them what advices has come to them. And we have got a service. It's a complaint suggestion box, we call, and people know a port number. So if they go to any health facility or any public health provider, and if they have got any complaint against the health facility or against the health provider, or if they have any suggestions to improve the quality of the services of the health facility of the provider, they can send any message. It's a free message. They can send to this port, and the National Health Authority receives the port and takes appropriate measures. And now we are in a development stage, a software or a SMS-based services for OPD queue management. Currently, what happens in the public health facilities is that the people, they go in the morning, but they don't know when the doctors will see them. But with this system, the people will send a SMS message to a particular port, and every 10 or 15 minutes interval, he or she will be given a time. So their time will be saved. And we are also introducing medication reminders. For example, the people who take the DOTS medicine or the hypertensive medicine or diabetic medicine, they will be registered into the SMS services, and automatically a reminder will be sent to them. In this month or in the next month, we'll introduce telemedicine services in 8 hospitals. So this will be a network with 2 tertiary hospitals, super specialist hospitals, 3 district hospitals, and 3 primary care hospitals. So the people who need special consultations will receive telemedicine consultations from the remote areas. And the telemedicine gadgets will be gradually added with this system. But to further expand the telemedicine services, in this month, we are providing web cameras to all the public health facilities. So the tertiary hospital, each tertiary hospital will receive 30 web cameras, each district hospital will receive 10 web cameras, and each Upazila hospital, that means the sub-district hospital, will receive 5 web cameras. And these web cameras will be used for remote consultation, although the bandwidth will not be that much good.